Good evening, everyone, and a very warm welcome to yet another episode of E-Gurukul, an initiative by Juventus, surgical skill transfer and solving of clinical dilemmas. We warmly welcome our esteemed faculty, Dr. P C Mahapatra, sir, as we all know him as a teacher par excellence. Today's episode is the 23rd episode of E-Gurukul, with yet another interesting and a learning topic from Sir as well. Today's topic is surgical tools and teams in obstetrics and gynecology, tips and tricks. With this warm welcome, I hand it over to PC Mahapatra, sir. Over to you, sir. Thank you.
Thank you, Nilesh, for the brief introduction of the E-Gurukul as well as to me. Again, I'm coming back in the 23rd episode of this E-Gurukul program, which has become very popular. Thanks to the team Juventus and all of you for making this popular and making me updating the knowledge as well as sharing my knowledge to the viewers, my gynecologists, my fellow gynecologists, my students, my grand students, my colleagues, my beloved people watching this particular episode regularly. Well, therefore, again, I bring this episode and thanks to Juventus, team Juventus for that, and welcome to the E-Gurukul of 23rd episode, which is really a Juventus initiative. It started with the Teachers' Day in 2020. And the main topic, theme topic, is a surgical skill transfer and solving clinical dilemmas. So every episode we focus on the particular aspect, one particular aspect, and discuss that and sharing my views on that particular subject. Well, we have almost covered 22nd episode on various surgical approaches in the obstetrics and gynecology. But this time is something different. I bring greetings from the place of Lord Jagannath, who will bless all of us in this really challenging times for that. And this episode, I think you must be surprised why I'm telling about this particular thing, surgical team and tool. Is it that important? For years together, we have been operating in both obstetrics and gynecology and various surgical approaches. And for the last 22 episodes, we have discussed about various surgeries. And now I feel that we have understood the disease, we have understood the surgery, we are utilizing the tool, we are utilizing the team. But let us understand these two valuable particular aspects dealing with the surgery, which is every day, all of you are operating all that. But there is something which is significant in this particular entity for ultimately giving a quality surgery to that particular person. And that's why I thought team and tool is very, very important. Let us discuss some of these. Don't think that I'm going to take a tutorial class on instruments or tools as postgraduate. I'm not bringing back to you on the postgraduates day. You are a valid consultants and surgeons practicing day in and day out obstetrics and gynecology. I don't have an audacity to tell this and transfer this to you people, the brilliant audiences. But I want to focus on a particular aspect where it is just a reorientation of what we have learned it and what is waiting ahead of these tools. Without these, we cannot do a good quality surgery for that in obstetrics and gynecology. Time doesn't permit me to elaborate all the tools that are available both in obstetrics and gynecology, but the commonest surgeries that we do it, that every gynecologist do it, I will just restrict those particular tools with that discussion within this episode of 23rd. Now, the basic facts, therefore, there is an importance of understanding surgical team and tool. Really, it's very, very important to understand that. Let us understand our team. Let us understand the tool before utilizing this in particular disease process or understanding the surgery. Second important, selecting the right tools. All of you, maybe at a medical college, maybe in your own setup, maybe in a private setup or in a corporate hospital or many private hospitals, all of you are practicing that. The right tools, you must select it. And without the selection of the right tool, You cannot do the proper surgery, number one, and particularly in the era where the technology plays a great role and high-tech gadget-oriented surgery, this is very, very important for that. A right tools is important. Unless you have a good tool, you cannot do a good surgery for that. If you take a scissor and they don't cut it, if you take a needle holder that is always slipping, I think the surgery, quality of surgery, you imagine what is the situation. You compromise if there is not a good speculum to retract the vaginal wall and you using the small sim speculum and doing it. How much difficulty you must get it. Forget about the high-tech gadget-oriented surgery. And more important is a gadget-oriented surgery. You must select the right tools for. Therefore, in gadget-oriented surgery also, a good camera is important and good vision, good hand instruments is important. So these are all important in endoscopic surgery also. And the right tool selection is also very, very important. If you are practicing, you have to select the right tool first. I remember when I was in a medical college, as usual, the instruments, the conventional instruments, you cannot use it. Everything slips. Alice, if you hold it, Alice always slips. I always tell Alice, particularly, there are three things which it doesn't slip. Alice, Follis, and Police. They must be tight. But our Indian Alice slips always. Indian Follis always ruptures and Indian Police slips. So this was the saying for that. So that if you do not have a good common conventional equipment, you cannot operate that. And particularly, this is very, very important, not only in the medical colleges, but also wherever you are practicing after learning also. Third important is evolving changes in technology. There is a lot of changes in technology now. Gone are the time when all the surgeries are done by conventional methods. Now where we have reached it, now 80% of the gynecological procedures are done by the endoscopy. And therefore, there you must update it with the advancing technology of that. And this technology is also gradually changing. It's absolutely a dynamic process and the technology is changing also every time. And therefore, you must be able to update your knowledge from time to time to keep at pace with the newer technology for that. Same thing, changing trends in surgical techniques. The surgical techniques also is gradually changing over past few years because by virtue of experience of last 4 decades, 40 years in this particular subject of gynecology, I have seen the evolution of the changing trends in surgical techniques as well as the evolution in the technology which has taken place, particularly related to the surgery in obstetrics and gynecology. Now then, the coordination of team. Team is important. If you compare conventional surgery with the endoscopic surgery, a high-tech surgery, and a gadget-oriented surgery, the quality of surgery is mainly determined by the lead surgeon in a conventional surgery. But in a technology-oriented surgery or in a gadget-oriented surgery like endoscopic surgery, the whole team is important. You are as important as the camera person holding the camera and assistant, as the staff nurse giving the instruments, as the OT technician dealing with the endoscopic equipment, changing the different pressures, light, camera, all these. So they are all equally important for that. So the team is important for the quality. Ultimately, if the team is good, the quality of surgery will be good. So therefore, there must be good coordination of the team. Then handling and maintenance of the equipment, this is very important, particularly in a very costly equipment. Even with a simple instrument also, the maintenance is important. The handling is important. How you handle during the time of surgery, that is more important. Unless you break certain of the valuable instruments, that is liable to break. So the handling is important and maintenance is important. They must clean it properly after the surgery is over, not that they throw it after the surgery is over. So maintenance of the equipment is also very, very important. Don't take it that casual. If you have a private setup, you must see personally that the maintenance of the instruments is more important than the purchase of the instruments also for that. Otherwise, you will suffer a lot. And last is need for, therefore, there is a need for a training and motivation of the staffs dealing with this, particularly the OT staffs, the staff nurse, the OT technicians who maintains the equipment. They must be properly trained for that. I imagine that there are lakhs and lakhs of hospitals and gynecological centers all over the country, small, medium, big centers for that. And therefore, I thought there should be a training of the OT staffs how to maintain the equipment for that. Way back before the corona, I decided that in my own city, suppose there are 50 hospitals and nursing homes are there, small or big. I wanted to do a training of the OT technicians, bring them, giving a free training and orient them on the common subject of how to maintain the equipments, how to take care of the instruments and all that. So this is important. This is very small thing, but it's very, very valuable. And that's why I thought in this episode, I will tell these things which are being known to everybody. Just I'm hammering and reorienting the concept. Now coming to the surgical team. In the surgical team, you have a lead surgeon. That's important. And lead surgeon is very, very important as far as the quality of surgery, particularly in conventional. And particularly, this team is important. It's not that lead surgeon alone is important. It's technology oriented, as I've already told, that everybody is equally important for that. A lead surgeon does a very good surgery without a headache if a good assistant is there. And if you find a good assistant, the surgeons becomes very, very peaceful. And who is a good assistant? I always ask this question to my assistant. What is the quality of a good assistant? Those who say that, those who know this surgery, who knows that, no. The main thing is that these assistants should know what the surgeon thinks ahead. What is he thinking? If he could know it, he's the best assistant ever possible for that. And therefore, a good assistant facilitates the surgery and relieves the headache of the lead surgeon, so that ultimately everything becomes very smooth. He guides also. At times you see the surgeon doing a surgery. The assistant, don't ignore. I don't ignore the assistant if he or she tells something. Sir, this is the problem. This is the thing which he may suggest. Don't think that he will not suggest. Even the staff nurse can suggest. I will not ignore it. I will just confirm it and say that if suppose somebody tells something for that. Then the trolley nurse is absolutely important. She must be absolutely well versed with the intricacies of surgery, not only with the instruments, the tools, but the intricacies of surgery also. And that depends on how much time she gives and how much time she is there with the particular surgeon for that. A surgeon operating with the newer staff may be difficult, very difficult for that, particularly in workshops we have faced that. But if you are a regular assistant, a regular team, I think the surgery becomes much more easier for that also. And we have felt it because I have a training center and many new people come and the trainees want to assist me and all that. I find the difference for that. For the sake of training, I have to do that. But the surgery, I think, becomes very, very smooth if the same staff assists you. You know the setup very well for that. And along with the trolley nurse, the circulating nurse is important. Don't think that he will bring everything. One person will be strictly available in the OT to supply if any other instruments is required. Immediately the circulating nurse will provide that. Not that the trolley nurse will go and bring that instruments particularly for you. So circulating nurse is important. Another nurse is important for that. Then the OT technician. OT technician is absolutely important, more so in endoscopic surgery, in gadget-oriented surgery. One person should be there handling the basic surgical equipment. Because every time you need to change, the pressure changes will be there, the light changes will be there, the camera adjustment will be there, the recording will be there. So all these OT technician well versed with this electronic gadgets must be there for that. And therefore, this is not a small thing, but this aids to the surgical quality. And therefore, this team is important and motivate the team. And this team will give a good quality surgery for that. Apart from it, the anesthesiologist and team. I've already told about the role of anesthetist, particularly in surgery and managing particularly the intrapartum, the intraoperative period for that. So anesthesiologist and the team and their own tool. I think that's important. Neonatologist and team, because obstetric practice needs always a neonatologist. And therefore, the neonatologist and his team, that should be ready for that. And so that the things will be much more better in obstetric practice while doing particularly cesarean or delivery or whatever you do it. And apart from it, really, you take help from ancillary persons, your own colleagues, your own friends. this and general surgeons, the GI surgeon, the urologist, plastic surgeon, cardiologist, and other faculties people. You may find that in pelvic surgery, there could be need of a helping hand by the general surgeon, by the GI surgeon, by the urologist. And these are the plastic surgeon while doing some of the plastic, I think the surgery, particularly for anomaly. We are doing a Mullerian anomaly. And these are the cases where the plastic surgeon helps. And particularly if there is a pre-existing comorbid conditions, particularly the cardiac cases and all that, the help from the physician and cardiologist is important. So this overall includes the whole surgical team, which is very, very important. And a very good coordination between these teams help not only the quality of surgery, but makes it is congenial atmosphere and things will be okay for that. And that's the importance for which I want to just again highlight for that. Just this is my surgical team in my OT. Anesthetist is there, assistants are there, OT nurse is there, circulating nurse is there, and OT technician is there, the pharmacist is there, the anesthetist is there, the pediatrician is there, the neonatologist is there, everybody. With a small setup also, you develop a small surgical team, which must be very coordinated, dedicated, and motivated team for the ultimate success of surgery for that. Now, let's enter into the OT. OT setup. This is an OT setup. I'm just showing a brief thing. These are all endoscopic gadgets with the pendants. Pendants is very helpful in reduction of the space. And this is the OT table with the anesthetist workstation and the monitor. And these are all emergency medicines which have been kept there. And these are all recording system in the computer that is bedside there. So this is a small OT setup. Even with the small OT setup, these are some of the essential tools which is required for functioning. This again, you see the OT table. We for gynecologists, we don't want a very sophisticated OT table, but at least a change of position. A motorized, I think, motorized table in addition to the mechanical, this for the Trendelenburg, reverse Trendelenburg. This is important, particularly for gynecology and obstetrics. And rarely we have to change from tilting side to side for that. So this remote control and automatic OT table making a position is important for facilitating the surgery. And we do not want a C-arm always. We do not want some sophisticated table, but at least the facilities of the OT table with the stirrups, very important. We mainly for the position is important for all of us in gynecology, lithotomy position and various positions. I think this is important. And this pendant, so the basic electronic equipment, I'm just showing you what is this is the light source. Then that we will discuss the different endoscopic gadgets in the next particular couple of slides, which will be shown there. And now coming to the surgical tools. What are the surgical tools that are required? There are various surgeries which is there in subjects of gynecology and obstetrics. We need a conventional surgical tools. We need an endoscopic surgical tools, and we need an obstetric surgical tools for that. And these tools are very, very important for that. And lastly, what are the future? What is the future surgical tools which is available for that? It's a fantasy or innovation, and the time will say what will be the future for that. But at least we should know what are the conventional tools. Day in and day out you are operating. What are the endoscopic surgery which is there? Many of you, majority of you must be acquainted with the gynecological endoscopic procedures, and that you should know it. And for obstetric, what are the basic tools, particularly for a vaginal delivery or for a cesarean section, which is very common? What are the obstetric tools which is required for that? That in this episode, I will just highlight for that. Now the conventional. Let us start from cutting. Let us start. So scalpel is the common thing which is being used by everybody for that. But remember, scalpel means any blade for any purpose for any surgery. Imagine that. Let us discuss something about this scalpel. What is scalpels? These are sharp blades used to cut or divide tissues. That is number one. And aid to skin marking. We give a skin marking for alignment, and that aid to skin marking. But don't cut with the sharp end, cut with the bewailing end with the tip. And normally the scalpel has got two parts. One is a detachable, disposable stainless steel blade, and another is a handles. And there are various sizes of the blades which are available, and there are a number of sizes, out of which I will just tell that for gynecologists and obstetricians, we require mainly four different sizes of the steel blades. Number 10, 20, and 11 and 15 for few cases for that. And I will show you which are the cases where 10 and 20, majority of the cases in abdominal surgery, in giving an incision on the vagina, you require a 10 or 20. But 11, a sharp pointed, when we want to have a point like drainage of the abscess, or particularly for laparoscopic port, small port, a 5 millimeter port or 10 millimeter port, the number 11 blade is suited for that. Number 15, you need, if you are going for a surgery, very precisive surgery, particularly for vaginal fistula repair, very thing. So these are the cases where you require number 15. And handles are also different for that. Handles of each detachable, disposable blades are different forms, and that we should know it for that. And the technique of holding, how to hold it. There are two types of grip. One is a pencil grip, another is a power grip, which I will just demonstrate what are those. And angle in which it is there, 20 to 30 degree, number 10 and 20 are hold in 10, 20 to 30 degree angle. Whereas number 15 is hold in 45 degree angle. And number 11, absolutely 90 degree, you must hold it with that. And you see, these are the cases, A, B, C, D. A and B are usually 10 and 20, whereas the C is number 15 and D is number 11. So these are various blades available, 10, 11, 12, 15, 20, 22. But we are using mainly these four blades commonly. And the pencil grip, where you see the number A here is a pencil grip, whereas the number B is a power grip for that. This is a power grip where the whole hand is just grasping the blade for that handle. Whereas here, the index finger is on the leg like a pencil grip for that. And see, these are the cases where the inclination, the angle of inclination particularly varies, whether it's a 90 degree in a case of the puncture, in a case of number 15 where you are using it, number 11 where you are using it, or in a case where 20 to 30 degree is enough while doing a conventional abdominal surgery for that. Now, again, I will show you the video picture here to clarify this. These are the three blades most commonly the gynecologist uses for that. And out of which the commonly the number 10 or 20 are being used, particularly for giving an incision on the laparotomy or giving an incision on the vagina in a case of vaginal surgery, whereas the number 11 is used particularly for drainage of the abscess, or in a case of small stab wound for that. The small stab wound is given commonly the laparoscopic port entry, and commonly 5 millimeter, 7 millimeter, and 8 millimeter for that. So these are the handles for that. This is a number. This is very, very important to find out this particular thing. And here is a case where the different sizes, different shapes of the handles are there, and this handle can be designed in such a way to have a firm grip, and these are for normally giving an incision. But where you want to have a debulking surgery, more study instruments is necessary for that. This is for giving an incision, which I'm showing you. This is number 10 and number 15, and this is triangular is number 11 for that. This is the three which is commonly being used for that. But the other equipment are with the stout handle or the different shapes. These are the handle, different designs of the handles. But the stout handle, they're more commonly used for debulking. When to reduce the size of the myoma in a case of vaginal surgery, you use this instrument. Otherwise, the blood and needle will not be very stout for that. This is important. Or not a detachable, absolutely like a knife, like a sharp edge. This is more useful for cutting the uterus, particularly the myoma, adenomyoma, and all that. This helps in the surgery in a very big way for that. Then coming to the seizures. Seizures use, what are the use of seizure? Division of tissues, dissection, very important. In addition to division of tissue, dissection. The dissection is mainly done by the seizures, the cutting threads, then removal of stitches. These are the four main uses of scissors for that. And the types of scissors are very different. Jorgensen, Mayo, Mezenbaum, and out of which commonly use the Mayo scissor and Mezenbaum. These are the common thing. Rarely in Jorgensen scissor is a long scissor and blunt tip, and these are being used particularly in pelvic surgery in case of lymphadenectomy. In pelvic lymphadenectomy, long scissor is necessary with a blunt tip. So these are important. Otherwise, majority of the cases, we use it with the Mayo and Mezenbaum scissor for that. And either it could be straight or curved or various designs for that. So 8 inches to 10 inches is the maximum thing which are commonly being used for that. The varying length and designs are also different. And it could be TCI, tungsten coated, carbide coated, or but the sharp edge could be there. So this is one example where I'm giving you that this is particularly the scissor, long scissor, which is helpful. And this is Jorgensen scissor, where the tip is blunt. Whereas this is Mezenbaum, is a thin, and the dissection is very important with that. And these are all Mayo scissor, straight scissor, and commonly we use the curved scissor like that. And these are the again varieties of scissors that can be used it. And the scissor, this is one scissor where this is commonly being used particularly for episiotomy, but with the normal Mayo scissor also you can do the episiotomies very well for that. And this is example of scissor in the video. You can see that these are the scissor with a straight curved Mayo scissor, and particularly and these have a various length for that. And commonly you remember that this is Mayos, which is very commonly used for that. These all could be the straight or a curved, but remember the dissecting scissor or the cutting scissor, you must keep it separate. So the cutting scissor, cutting a thread, you must not use the same scissor with this dissection for that. Otherwise the edge will be spoiled for that. So these are some of the examples where scissor can be of helpful for that. There's a various different type of scissor which can be used, and this is one of the example where I'm giving you this particular thing that it can be used for stitch cutter. So removal of the stitch, this is a separate scissor which is there for that, and thread cutter must be different from the dissection for that. So make it a point for that. Otherwise, for maintenance of the equipment, this is important. Now coming to the dissecting forceps, next is the dissecting forceps. These are to hold tissue during dissection and suturing, grasp vessels for electrosurgical coagulation, extract needles, and pack sponges. These are the 4 basic use of the dissecting forceps for that. And there are varieties of dissecting forceps which is there. You can see there are tooth, there are smooth surface for that, a blunt surface, and these are all called tweezers, very fine tooth. This is mainly responsible for electrosurgical coagulation. Small tip, this is important for that. And the size will also vary. It could be a small size or it could be a large size, and long length, particularly for pelvic surgery, we need a long length for that. And depending on the tip, whether it's a tooth or plain simple, I think that design is different. And the module also is dissecting forceps. You must select all these varieties for that. And here you see, I have displayed all these for you, that this is particularly the small tweezers, which is important to catch hold of the vessels and then coagulation. And these are all the smooth surface. Can you see that this is a smooth surface? This is tooth, this is smooth surface, and another is tooth. The tip is tooth. So these two are smooth surface and this is tooth, and that is important. What is the tissue you are handling? A soft tissue you can use with the smooth surface. In a tough tissue, you use a tooth surface for that, for holding, and the dissecting forceps for that. And this particular thing, you can use it for electrosurgical purpose and to hold the small vessels and coagulation. These are all tweezers, called a tweezers for that. Now coming to the needle holders. Needle holders are otherwise called a drivers, needle drivers. This is not only the holding the needle, but it drives also. So therefore, the best name are absolutely better terminology and name nomenclature is a drivers. This is again a various sizes and shapes are available, but ultimately the main thing is that a stout grip. The needle should not slip. Suppose the needle slips while taking a bite, at least all of you must have experienced how difficult it is. Stout grip is essential for that. And gripping the needle in 90 degrees is important, 90 degree. And remember, as the conventional dictum still holds good, 23rd and 2/3 and 1/3 of the needle. And that is the point where you yield it. And in some cases, you may angle the needle, hold it in an angular fashion, particularly in vaginal surgery, in a deeper plane. While taking a bite, we recommend that. And either it could be a forward movement or a backward movement. You can take, particularly this is important in a case where you take it from front to back or from back to front. It depends on the space which is available for that. Both in vaginal as well as in conventional abdominal surgery, this forward and backward movement is essential for that. And these are some of the needles which is there. It could be a straight needle, or it could be a carved needle. It could be a TCI, tungsten coated, carbide coated needle holder, or of various dimensions also. Commonly is the 8 inches or 10 inches is enough for that. We use the 8 inches, and commonly for gynecologists, I personally prefer the carved tungsten coated is absolutely a fine needle holder which helps in all purpose for that. And this is how we demonstrate all these. And these are some of the needle holder which I'm showing you. This could be straight or carved. And this is tungsten coated, straight, long, depending on the tissues of dissection. I think if you are going for a deeper pelvic tissues, the longer dimensions are essential. Whereas a small tissues in oval, that superficial, we use a long, I think a short thing for that. And this is the mainly the stout needles could be there, stout, the holding after needle, the being hold, it should be a stout grip. You see the inside groove which is there, and the middle of the needle holder, which gives a very good stout gripping for that. And this groove helps in that. And remember, this straight, we gynecologists mainly, we are very, very inclined to the carved needle holder. And this carved needle holder is a absolutely immense value for that. This is one of the rare needle holder which rarely I'm using it. This needle holder cum scissor. This is a needle holder cum scissor where the proximal part is a scissor and the distal part is a needle holder. You hold it particularly while in the skin or some superficial areas. This is of helpful for that. So you just suture it and just advance it in the proximal. You cut it. The same thing, you don't depend on a resistant to cut it for that. But this is a very valuable instrument which I like it. And all gynecologists are very, very familiar with this carved thing for that. As we are very favorite for a carved clamp, we are also carved needle holder is a very favorite procedure for us in almost all procedures, both in vaginal as well as in abdominal procedures. And 8 to 10 inches enough for that. And preferably, it could be a good grip if a TCI coated will be there for that. Now coming to the tissue clamps, there are various types of tissue clamps which are available: hemostatic clamp, Cocker's clamp, right angular mixture, hysterectomy clamps. Day in and day out we use it for that, and of course rarely the bowel clamps. And just remember, these are all hemostat. When we were students, there is a Spencer-Wells hemostatic forceps or artery forceps. These are all to catch the vessels, and the sizes also varies, starting from the mosquitoes Spencer-Wells to as long as 10 inches, 8 inches to 10 inches for that. But 6 to 8 are in between the average sizes. It could be straight, it could be curved. It has many purposes for that. Primarily, it is mainly for hemostats, and these hemostats to catch hold of a small vessels, and then you just tie it. Now the indications are less. Now we are depending mainly on electrosurgery, and tweezer can help so that the small needle holder catching the vessels and then tying it with the plain catgut doesn't arise for that. So for other purpose it can be used. It is used to hold the peritoneum, to hold some of the structures for particularly when there is a soft structures, mainly we use it for that. But still, for division of the tissues also, you can hold it on two sides, and in between you can cut it for that. These are all, these are on the right side, there is a mixture. In the center, there is a clamp which is there. And on the extreme left is a straight needle holder. This can serve the main purpose for that. It can in obstetrics also, you can use it for cord clamping. This is a common thing for that. Or to, this is mainly for clamps, which are commonly being used. There is a curved clamp and a hysterectomy clamp. You see the interior, how delicate it is, so that ultimately it doesn't slip for that. It's a absolutely little curved, and these are all hysterectomy clamps, which is very, very important day in and day out we use it. These are another type of hysterectomy clamp, which is important, is a little curved. And our series set has devised a clamp, series set clamp, which is a S-shaped long clamp for infundibulopelvic. But this clamp is a very delicate instrument, which is very, very favorite of mine. This can hold two purposes, mainly on the infundibulopelvic or on the first pedicle during the vaginal hysterectomy for that. So all these clamps can be used particularly both in vaginal as well as in abdominal surgery. And these are mixed at the right angle. This serves as a dissection also, along with the large artery forceps, which helps in dissection. This clamp also helps in dissection for that. And these are all again the hysterectomy clamp, very stout, and it doesn't, tissue doesn't slip in between for that. So this is very, very essential and a special instruments for hysterectomy, both in abdominal as well as in vaginal surgery for that. Now this is again a clamp with the curve, with the tooth in the end, and these are all typically Cocker's forceps. And this Cocker's forceps is Cocker's clamp is either a straight or a curved, and this curved Cockers are very often used to hold the uterus, particularly for abdomen during abdominal hysterectomy, and the straight is mainly for the Macken-Rods and uterosacral during hysterectomy, or in obstetric also for very commonly used for amniotomy, we can use this clamp for that. And the curved clamp can also be used as a pedicle clamp for hysterectomy if you do not have the conventional classical the hysterectomy clamp like this. So these are various designs of the various Hini has initially identified, Mangot, Hini, these are all initially diagnosed for that. And therefore, you can see here that the A, B, C, there are groups and regions where this is mainly important not to slip the tissues in between. But here, multiple serrations in between can have a very good grip, and that is important, which I've already showed in this particular thing. Now, coming to the tissue forceps, the Ellis tissue forceps, sponge holding forceps, valsellum, Lance tissue forceps, little Lutz forceps, bulldog clamp or bulldog forceps, cat's paw, and the towel clips. Towel clips are common thing in all draping, you must use it. But remember, the nature in which you do a towel clip, the towel clip should be inside, not exposed to outside. You fix the drap in such a way that the towel clips must be inside for that. And these are all tissue clamps. The first one, we know that is a Babcock's forceps. They are traumatic for some delicate tissues. You hand it for that. And these near the load down, we see that these are all bulldog clamps, which is there. This is Ellis, both straight as well as curved Ellis tissue forceps for that. And these are all over the sponge holding forceps, serving a multi-purpose. In multiple level, it helps for that. And this is all, this is a very instrument which was being used earlier, green Hermitage clamp. But this green Hermitage clamp nowadays, where nobody is, it's almost obsolete. Nobody is using this. Everybody is using for the Ellis tissue forceps for that. And this is the next thing is a cat's paw, which is very important for giving a good grip to the tissues. And this tissue, particularly for the hysterectomy, for myomectomy, this is very, very important for that. And you see now that this is demonstrate that this is the Ellis. You see the Ellis may be of two types. One is a traumatic Ellis, now commonly being used particularly, and the dimensions are varying. This is a traumatic Ellis. These are all tooths which is there, but the first one is the atraumatic Ellis, and these are all atraumatic Ellis which can be used to hold the soft structures for that. And these are all, you see the atraumatic Ellis. This can be soft structures. the uterine edges, particularly the cesarean section, this is being used. And these are all wide, so that this area, the edge is wide, dimensions a little more. And therefore, the various designs of the Ellis, and it's a straight Ellis, we can use the curved Ellis particularly for some purpose for that. And these are all Babcock's tissue forceps. Length and the designs are all same. The distal designs are same. The length varies, and the length depending on the indications, we use it for that. But remember, Babcock's is only used to hold the very delicate structures like a ureter, like a tube, and very, very important, where we do not want any type of trauma with that. Now, this is again the another clamp, another tissue forceps, which is there. This is commonly being used to hold the cervix. And for holding the cervix, we require some tooth and some tougher Ellis for that. And this is the single tooth or a multiple tooth. These are all multiple tooth Ellis forceps, tissue forceps. For that, it is not exactly a valsalum. Valsalum I'll show you here. But here, this can be tougher structures like a rectus sheath or Ellis, commonly the Ellis. These are all little wood forceps, and little wood forceps is mainly for the Ellis and the tough structures like a rectus sheath for that. These are all causes a little trauma for that, and this is important. And this is the classical valsalum. Earlier, we had used to hold this with the valsalum, but due to the length of the valsalum and the space which is occupying, we rarely use this valsalum. This is single tooth or a multiple tooth valsalum, but in some cases where you want a firm grip, you can use this valsalum for that. It is also not to be discarded, but we are commonly using the Ellis, is much more safer and commonly being used for that. These are a single tooth valsalum or a tenaculum, which causes a lot of injury for that. But top structures where you can use it for myoma also for removal or for holding the cervix if it slips. I think these are all valuable instruments for that. These are all the sponge holding forceps. Again, sponge holding forceps is a multiple indications and uses with that. And starting from holding the sponge to draping, to removal of the product of concepts and evacuation, to hold catching the particularly the cervix, particularly for cervical tear in obstetric practice. And all these, there are various indications of these sponge holding forceps. The long instruments, they carved or straight of various designs with the hole, or of various designs with the hole which is there. Earlier we are using the ovum forceps. Now ovum forceps is almost an obsolete instrument for gynecologists and obstetricians. We are using this design, and there are various patterns. The sizes also varies, and we can use it depending on the indications for that. Now, coming to the suction devices, another important thing which day in and day out you must use it. And there are various types of suction device, A, B, C, 3 types I have shown you here. The Youngquar variety, this is very important, particularly for Youngquar is there. And the number 1 is known as the Youngquar method is in A, the Frazier is number B, and Pull is number C. And these are all metallic and reusable equipment, reusable suction devices where we use this. And the number C, the pull instruments can be 2 segments which is there, which you incorporate these 2, it will have a sharp suction for that. And this is very good for abdominal surgery because the bowels will not stuck to the center, so that ultimately suction is being impaired. Here the side holes will drain it, and just put it inside the bowel, inside the peritoneum also, it will have a good suction for that. And therefore, suction is a very important tool, particularly for during a surgery. And particularly I always recommend the suction more important than the mops. Don't use the mops. Mops will cause a minute trauma and adhesions for that. I use list mop, and forgettable mop can give rise to medical problem. And therefore, this suction devices can be of very good help for that. And lastly, it have a fiber optic devices also. The suction along with the fiber optic attachment. I remember one of the company told me, and I designed one of the methods with the suction and fiber optic in one end with the Y shape. And this is a very good for surgical equipment for surgery, particularly for pelvic surgery as well as for vaginal surgery, where suction by suction and illumination of that particular level, you can pinpoint where the bleeding is and then target and catch hold of that, either with the artery forceps or with the suture or with the coagulation for that. And it could be disposable versus reusable. Some of the Romson's reusable suction are also available, and this is one of the example. One of the example where the
Hi, admin.
I think so. Mahapatra sir has
Log
lost
out
his
for me.
connection.
Connection
Networks, I
log
think.
out.
Yeah, probably connection lost. I'll just call Didi Chaudhary.
Sorry for inconvenience. There is a technical issue, and PC sir will be back within 5 minutes. He is joining back within 5 minutes. Sorry for inconvenience. There is a technical issue, and PC sir will be back within 5 minutes. He is joining back within 5 minutes. Sorry for inconvenience.
Hello. Yeah, Rushali. Hello.
Hello. Sir.
Now what is the option? I thought
Sir,
something is wrong with my laptop. Mala vatla.
no. Sir is joining back within 5 minutes. I have already conveyed this.
ठीक है. Okay, मला 2 मिनिटं वाटलं something is wrong with my laptop.
Okay, sir. Actually, I have spoken to Dr. Dili Chaudhary, sir. Nilesh, sir. Mahapatra, sir. Laptop is having some issue. They are fixing it. May take 5 minutes.
हाँ ठीक है ना. तो let us put the banner that due to some technical problem or something like that. ऐसा banner डाल सकते हैं क्या admin?
Yes, admin, can you
एक
just put
बैनर
a
डाल
banner?
दिया है, webinar will be start soon.
Okay. Start मत डालो, resume डालो, resume.
And
Resume.
recording stop karo. Recording अभी. No.